He's a beautiful guy, just came from India, who started the Integral Yoga Institute in Danbury, and it became a national yoga institute. I don't know if you know Swami Satchidananda, a beautiful person.
I know
Uh,
about integral yoga.
Integral Yoga.
Well,
He started
Sri
it.
Aurobindo did integral yoga work.
Yes. Well, he
And,
may have been a follower of Aurobindo because he was just a beautiful guy.
yeah, and the
And then
mother.
about, right. And so a month later, he says, hey, Doc, I've been corresponding with a guy named Paul Rollins. I said, who's Paul Rollins? He says, well, he wants to come in and lead us in a yoga group. I said, wow, that's great. Let me meet with Paul. So I met with Paul. Paul was a TWA pilot who had dropped out in the 60s. He was living in Danbury, but he was going into New York as a student of Ram Dass.
Mhm.
And Ram Dass had a prison ashram project. He would send people in to prisons to see if he could transform prisons into ashrams, okay? To make them paranoid systems into peaceful and compassionate systems. So he had about 500 prisons that he was working with, and Paul was a student of his, a meditation student.
Okay.
And so I met with Paul. I liked him right away. I went to my associate warden. I said, Max, we want to start a yoga group. How do you feel about that? Because you have to, pass through everything in a prison. He said, okay, Steinfeld, but I want you to be there because they're going to bring in contraband, and you have to be very careful about that. I said, thank you very much, Max. Okay, so for the next 2 or 3 years, we ran a yoga group in the prison. And so inmates would come, some of in our program, but others of the 2,000 other inmates that were in the prison at that time. And we were trained in yoga postures, meditation, breathing exercises. And I remember Paul brought in, he's a wonderful person. He also turned me on to a mushroom later on in my life, but that's another story.
Wee.
So, so, so he brought in a woman called Soma Krishna to lead us in a meditation, also a New York student of Ram Dass.
Okay.
And she said to us, I'll never forget this because it's stuck in, ever since I've been meditating. Now, this was in about 1975, okay? No one was doing meditation and yoga at that time. Or very few people were. And she said, ever since I've been meditating, I haven't been anxious, depressed, or angry. I said, holy shit. I said, this is the world that I work in. I'm going to study this. So ever since then, I got all of Ram Dass tapes, everything I can get my hands on. I went to his workshops around New York State and in Connecticut. And I've been following Ram Dass, with whom I had a Skype meeting about a month ago. Okay.
Okay.
It was a beautiful session. I just thanked him for everything. I said, you saved my life, Ram Dass. It was a beautiful Skype talk. And so that was part of my transformation into the spiritual realm, from psychotherapy, psychoanalytic psychotherapy, behavior therapy, cognitive behavior therapy, transactional analysis, and then Buddhist. I'm really interested in Buddhist more than Hindu work. So that got me interested in the Eastern traditions. That's essentially where I still am now.
That's multiple level paradigm shifts you got going on there.
Yeah. I would never have thought that I would be interested in any of this when I started out. No, it's true. And then I've come a little further, which I'll be happy to share with you down the line after you ask me whatever you want to ask me.
Now, during your initial training, how would you how would you look at it in compared to what happened subsequently?
My initial training has about 5% of what I do now.
Okay.
In other words, psychoanalysis, although psychoanalysis, and with all due respects, has really changed, but there's no evidence for the effectiveness. I'm trained as a scientist practitioner. I'm interested in raising questions about what's effective and what's not in helping people to reduce their suffering. Right. Psychoanalysis, I know people who have been in analysis for 50 years. I mean, that's absolutely crazy. That's crazy. It's so exploitative, and patients or clients don't know anything else. They don't know the questions to ask. They don't know why they're even in therapy other than the fact that they're suffering. You go to an analyst, back then at least, you would go 3, 4, 5 times a week. And I was in therapy with an analyst when I started my graduate training at Yeshiva University in 1961. I said, I'm so screwed up that I better enter therapy. I was in therapy twice a week for 3 years until I went on internship in 1964. My therapist may have said to me 3 or 4 things in the 3 years I was with him.
Wow. So it's just a session that you could just go and talk.
Yeah, I thought
you could have done that in a recorder.
Yes, but no, it was nice. I'll tell you, in all, look, look, I really cared about him. I wanted to please him. I was, in that state where I wanted his approval,
Yep.
and so I would talk openly about everything that was going on. My father died soon after I entered graduate school. He was there for me. He said a wonderful thing to me when I was weeping and grieving and crying, and I would come in and sit down and just cry about my father's death. And one day he said to me, after I was doing this, I would just do that. I don't even know how I got through the first year of graduate school because of my father's death. But as I was really weeping one day, he said to me a very interesting thing. It was very important, actually. He said to me, I almost feel what you're going through. He did not say, I feel what you're going through.
No.
Right? Because he could never feel what I'm going through. But he was really letting me know that he was really doing his best to hear my pain. So that was very important to me. He said a few other things. He said another thing I remember him saying, I was complaining about my mother still at that time because I was into analysis, and everybody in analysis complains about their mother. So
yeah.
I was
the root of all of our problems.
The root of all of our problems. And so I was complaining about her, and he just said, your mother had 4 men to take care of. I said, what? My mother had 4 men to take care of, which of course was true. My father and 3 sons. Yep. I never thought of it that way. It was only supposed to be me, right? I was so egocentric, right, at that time that, if she wasn't focusing her whole life around me, I was fucked up, right?
Right.
So that was a good shift in perspective. And I'm writing a book now called Shifting Perspective, which is really a cognitive spiritual orient. When you shift a viewpoint, you shift a perception of reality, it has a profound effect on how you feel and what you do. And so that work on shifting perspective came out of early work that I did at the university, and I published a paper on that. And then I came back to it later and wrote a paper called Is there a spiritual foundation for is there an empirical foundation for a spiritual psychotherapy? I wrote that Journal of Contemporary Psychotherapy, in which I pulled together, that was about 10 years ago, I pulled together all of my thoughts about psychology and how it could become a spiritual quest.
Okay.
Okay, so that's essentially where I've been the last.
Now, George, I have a kind of a unusual question here now. Yeah. During your training in the university, and maybe subsequently after in your early works, mm-hmm. how much time was it spent that when you saw a client, right, mm-hmm.
And
not knowing what this individual had gone through,
right,
physically, when somebody, is called a schizophrenic, schizophrenia could be a simple situation that can be overcome with time, but it could very well also be a physical problem with a chemical imbalance or some sort
Right.
of, a head injury or something.
Right.
How much time is actually spent in identifying those kind of problems that may exist or pre-exist with this
That's
individual?
a very good question. So we would do all of that exploration, okay, with the clients because we were into analysis and wanted to know as much as we can about their history, okay? Now, a fascinating thing, which also is a very turning point in my life. I had tried everything, and she's been on a lot of different medications, right? So, you go into a mental hospital, that's all they do is put you on medication and turns you into a little zombie. That's one of the things we argued against, okay? Because when you turn a patient into a zombie, they have no voice, right? They can't articulate their feelings and thoughts. They define themselves as sick people, they define themselves by their label, you see. That's why Zaz's work, The Myth of Mental Illness, is such a profound work. To me, anyway, not to other people in our field, because they keep on writing DSM-3s and 4s, and now a 5 is coming out, where they diagnose people, and then they treat them a lot with medication, okay? After they've created a problem, and then they treat them with medication, okay? It's a crazy system. The whole mental health field is a crazy system. So, of course, we explored her whole history. And so I tried everything I could possibly do with this young lady. I had read everything in the field of psychotherapy. People like Harold Searles, who worked with schizophrenics. Frieda Fromm-Reichmann, who dealt with schizophrenics. A book was written. I can't promise you a rose garden. I never promised you a rose garden based on this work. And so I read everything, and I also even read a person by the name of Rosen, who did direct psychotherapy, direct psychoanalytic psychotherapy, where you challenge the belief system of the patient. So one day I come in to see Joanne. I've tried everything. Nothing is working, right? And I decide to try direct psychoanalytic psychotherapy. I almost drove her crazy. She got so scared of me that she refused to see me for months. 3 times a week, I would go to the back wards where she was. I would say to the nurses, I'm here to see Joanne. I would sit in the room. She would never show up. 3 times a week, I did that for months, okay? Please tell Joanne I'm sorry if I upset her. I would like very much to talk to her, etc., etc. Finally, she came back. Of course, I apologized for upsetting her. I didn't know what the hell I was doing. I was trying everything I could, okay? But I said to her, Joanne, you're like I never forget this, you're like a rock. You hold on to your beliefs with intensity. And she looked at me, at least in my memory, this is what she said, that's the only thing I have. That was a profound moment.
It's an identity thing.
It's an identity thing,
yeah.
Exactly. If she let go of who she thought she was, she would lose her identity, and that is so anxiety producing that she couldn't handle that, okay? And that's one of my still beliefs now. There are core beliefs out of cognitive therapy, which I then studied with Albert Ellis. You know Albert Ellis at the Institute for Rational Therapy? He's one of the leading cognitive therapists. He was the first cognitive therapist, and then I studied with him in the 70s.
Okay.
And the cognitive therapy is about what you believe, okay?
Right.
And if you have core beliefs to which you are attached, using the Buddhist word attachment,
right.
If you're attached to that belief system, that is who you are. It is extremely difficult for a person to let go of those beliefs.